Bird flu has been known since the 1990s. It is back in the headlines right now and being followed very closely by health officials.
Usually mainly found in birds, this year has seen the largest outbreak in cows ever, which is raising questions about our milk supply. So we're joined by Dr. Frank McGeorge to answer some questions. Yesterday, fragments of the virus were found in pasteurized milk. So, that raises the question, should we be concerned about it?
So the important thing is, at this point, the answer is no. Here's why, though. Although the virus is excreted into the milk of cows that are infected, there is no direct evidence that this would cause a human infection if someone drank the raw, unprocessed milk. However, even if that turned out to be possible, the vast majority of milk that's sold commercially in the U.S., well, it's pasteurized, meaning it's actually heated to a level that any potentially live virus would be killed. Then to take it one step further, when we drink it, our own digestive system would further protect us. Now, the detection of fragments in the milk is, of course, importantly different than the detection of live virus in the milk.
So I'll put you on the spot with Michigan's dairy farmers leaning in, listening closely. Would you drink milk right now, given everything you know?
Yeah, I would. I mean, I think it's a completely safe supply, and I would drink milk without hesitation.
Yeah. Putting milk aside, though, how much of a risk is there from getting bird flu from something else, just say chicken, maybe?
So if you were talking about cooked chicken or maybe chicken from a grocery store, the risk is zero. But to your point, the Michigan Health Alert Network actually put out an alert today asking health care providers to be on the lookout for human cases of avian influenza. And here's the reason. In Michigan, the virus has actually been found in dairy and poultry farms in Gratiot, Ionia, Isabella, Montcalm, Newaygo, and Ottawa counties. So we're really talking about people working on or visiting farms. If you are in those situations, you should watch for a cough, sore throat, eye redness, or discharge, or fever, or basically any other signs of an infection. But right now, again, you have to have direct contact with an infected bird or cow.
We're going to stay very dialed in. All right, Doc.